Hello and good afternoon or good morning, everyone. My name is Bethany Hamilton. I am co-director of the National Center for Medical Legal Partnership. You're joining us today on Wednesday, November 9th, 2022. It's 2 p.m. here on the East Coast. But we want to thank all of you who are joining us from multiple time zones and from multiple settings. Perhaps you are like the NC MLP team, still working from home, or perhaps from the office. That being the case, we know what we're still dealing with here with the public health emergency, and we hope that as you're joining us, you and your families are all happy, healthy, and doing well. Thank you for sparing this time to join us. Buying some time here as folks log on, and let me keep rolling through our opening remarks. Let's go to the next slide. As you join us here today, we want to acknowledge that this is a HRSA-funded webinar. The National Center for Medical Legal Partnership is actually in its 9th year of funding to provide training and technical assistance to health centers as our target audience under this federal award to be able to implement medical legal partnerships and better address the social needs and legal needs that are health harming to their patient populations. I am very happy to note that through the large majority of our work, and especially on today's webinar, we are hoping that the content that will be provided today will be easily transferable and applicable to multiple health systems and across settings that where MLPs have continued to flourish around the country. So thank you to HRSA for supporting this event and really helping us to leverage that funding to support the integration of legal services across health systems. Also, I want to take this moment to really thank our veterans, service members, their family members. Many of you, like I am, right, have that direct connection to veterans, either in your family or your friends or colleagues. And we know that Veterans Day is coming up. And so as we approach, this Veterans Day, we hope that the content provided on today's webinar, even as we prepared to launch live today, we talked about, what would be the correct way to really thank our veterans for their contributions, both through military service and in our communities now that they are reintegrated and carrying on their day-to-day lives. How do we thank them? How do we acknowledge them? So we're actually hoping that this webinar will support you in recognizing the role and the contributions that they continue to play in our communities and ensure that we can, in fact, provide no wrong door to ensuring the provision of services for our veterans. All right, let's go to the next slide. So just some quick housekeeping. As is par for the course now, you are joining today's webinar on mute, but we encourage you, please, as questions arise, type those questions into the Q&A. Don't wait. We're going to be paying attention to the Q&A to ensure that we can capture those questions and better address them at the end. And if we can't get to a question live, we'll still capture it and do our best to follow up with you. So submit them as they come up in the Q&A. If you do need any help, you are welcome to email us at ncmlp@gwu.edu, but you can also send a message in the chat to the NCMLP team. Reha is joining us here, logged in as NCMLP, and then we also have Danielle Hodgson on the team logged in as herself. So you're welcome to submit a chat and we'll keep track of that to better assist you. If you need to activate captions on your Zoom platform, you should be able to select live transcript and then select show subtitle to allow captions to appear on the Zoom platform, the screen. Again, if you need support, email us or send us a chat. This webinar, yes, as always, will be recorded and we'll share as quickly as possible, both the recording as well as the slide deck on the NCMLP website, medical-legalpartnership.org. All right, let's go to the next slide. So on the next slide, we do have what will pop up in just a moment on the Zoom platform, a poll. We want to get to know who's in the audience today. We know who registered, but we want to know who was able to join us live. That way we can really tailor some of our remarks or even resources. We'll share it to you. So let us know who you are. Question number one, tell us who you are. Are you an FQHC or those health centers as well as health center lookalikes? Are you with a legal services organization? Perhaps you're with a hospital. Maybe you were with a VA medical center. If you are with a primary care association or PCA, please let us know. If you're joining us from a health center controlled network or HCCN, let us know. Perhaps you're from an academic institution or some other category that we didn't capture because otherwise this list would be endless. If that is the case, you're in the other box. Let us know who you are by typing into the chat and we'll call some of those out. The second question is, do you have a medical legal partnership? If you do, there are two options for you. Is it yes, and it includes a VA MLP? Or is it yes, but it's not inclusive of a VA MLP? If you do not, check the box no. If you don't know, check that box. And if you're developing an MLP, please, please, please let us know if you're developing it. We are especially, all of us here on today's call, trying our very best to provide additional resources to help those who are in the development stages really grow and advance those MLPs that are under development. We're here to help. This is why we push out some of these training and technical assistance events as well as written resources. All right, I think I've bought enough time. We have about 64% participation. So if you have not yet filled out the poll, I'm going to count down, and then by 5, 4, 3, 2, 1. And we'll close out the poll. And let's share the results. It looks like the large majority of the audience, live audience here today, is from our legal services organization. And then we have our FQHCs joining us. Thank you, thank you, thank you all for joining us, as well as some academic institutions. And let me just glance at the chat to see if we do have a sense of, and I may need assistance here. Oh, it looks like my audio is, I do apologize. We tried to fix it and it looks like the chat was also disabled. So apologies for both issues. I will do my very best to speak as clearly as possible. I promise I'm also not speaking for that long today, and everyone else's audio is apparently working. So thank you for letting me know. And I do apologize, folks. All right. So we have a large segment of our audience from legal services organizations, and then it looks like about half and half of the MLP bunch do or do not have VA MLPs. So we want to thank everyone for joining us, and we'll stop sharing the poll. All right, let me introduce you to today's panelists. Again, if you're joining us today, you have joined us on the No Wrong Door for Veterans webinar. Let's go to the next slide. Our goal here today is to hear from representatives of the VA, to help you better understand veteran cultural competency for MLP teams. So you will be hearing, not in this order, but she does take up the bulk of today's programming, Dr. Emily Edwards. Dr. Emily Edwards is actually director of the DBT for Justice Involved Veterans. She's based in Bronx, New York at the James J. Peters VA Medical Center. You will also be hearing from Lara Eilhardt, whose new title is actually Senior Attorney Medical Legal Partnerships. Lara has been truly from the Office of General Counsel, Department of Veterans Affairs, supporting the expansion of VA medical legal partnership, as well as legal clinics. And also we are joined by Lara's new colleague, Madolyn Gingell, and she is now the National Coordinator for Legal Services for Veterans, also at the Department of Veterans Affairs. I just want to note, I'm really emphasizing the newness of Lara's and Madolyn's titles and positions, and that is because of the work that had been done over the years to really help to establish and strengthen and expand VA MLPs. And so they'll be highlighting some of that growth, as well as opportunities going forward for continuing to expand the medical legal partnerships that are partnering with VA in particular. But you are joining us on a HRSA-funded webinar, and so we do want to also recognize the role that health centers have and continue to play in serving veterans that are in our communities, ensuring that they are in fact connected to healthcare, but also partnering with the VA to collaborate and ensure that, again, there's no wrong door for serving veterans. With that, I'm going to turn things over to, let's just go to the next slide so that we can have it ready for both Madolyn and Lara. With that, I'm going to go off camera and off microphone so that you can actually hear from our main speakers today. Madolyn and Lara, I'm sure your microphones are working, and I'll turn it over to you, and thank you.
Hi, everyone. As Bethany just said, I am going to start us off. I'm Lara Eilhardt with the VA Office of General Counsel, and my colleague Madolyn Gingell will also chime in a minute. So we wanted to just very briefly cover what are VA MLPs, and Dr. Edwards is going to talk about how veterans cultural competency fits into those scenarios. So if we could turn to the next slide, that would be great. I wanted to just start off with, maybe folks may not think of veterans and legal issues going together, but they often overlap because as we know, based on VA studies, that we have a survey called the Challenge Survey that consistently reveals every year that at least 5, and I think this last time it was about 7 or 8 of the top 10 unmet needs of homeless veterans are actually explicitly legal problems, things such as housing, eviction, foreclosure issues, family law issues such as child custody, and even divorce and child support issues especially. We also see a lot of discharge upgrades issues and actually even consumer and debt issues as well. So these are pervasive legal issues that we'd like to think of them as really they are social determinants of health, because if a veteran presents at the VA with, let's say, mental health issues, and then in the course of their treatment, they reveal that they are struggling with their paying back their child support, that they don't know how they're going to do because they can't find employment because they have a criminal record that needs expunged in order for them to obtain that employment. Those are 3 legal issues right there, and those interact with their health directly in terms of their well-being and sometimes their physical health as well. And we have also seen in VA studies that we know that these legal needs, when left unresolved, when just left and unaddressed, they can increase veterans' risk for suicide. However, when we do have VA medical legal partnerships where the VA physicians and clinicians are working with attorneys, we know that we've seen through VA studies that that can and does improve veterans' PTSD symptoms and improve and increase housing stability. So we know that veterans' legal needs are pervasive, and we know that medical legal partnerships can help. Next slide. And so what VA has done to address this is to grow a medical legal partnership program where we have this collaboration between a wide variety of clinicians, social workers, primary care physicians, emergency room physicians, psychiatrists and psychologists. And ideally, we want these to be co-located. And in many cases, again, they are being co-located and in person. They also worked well virtually, where they can jointly communicate about how to jointly assist both the veterans' health that VA can serve and their legal health in terms of those legal problems that we just talked about affecting other areas of their health. So we want you to just, if you're able to click on this link. This shows where we have across the country legal partnerships and legal clinics that resemble this collaboration. Next slide, please. And so beyond the MLP landscape, we also have about 150 pro bono legal clinics affiliated with or at VA facilities. These are both in rural areas where there's small community-based clinics, as well as large urban VA medical centers and everything in between. Vet centers that are actually serve all those who have served regardless of veteran status and family members as well. VHA has a directive, a specific policy directive that says, yes, VA staff, we encourage you to work with legal providers. In fact, we encourage you to make space for them to come to our facilities and provide direct legal assistance in the same space. So that co-location is really key. And VHA policy, specifically that Directive 1510, says medical legal partnerships are VHA policy. And so we're very proud of that came out about a year ago. And now, together, OGC, my office of the attorneys, works with the Homeless Programs Office and other parts of VHA to help facilitate and sustain these MLPs, to cultivate them and provide technical assistance. And so I'm going to turn it over to my colleague, reflecting that collaboration, Madolyn Gingell, right now. And next slide, please. And I think Madolyn, there you go. Yeah.
Great. Thank you. Thank you. Yes, we're very excited to share that there is a new authority for legal services grants. Section 548 of the National Defense Authorization Act focuses on discharge upgrades and benefits of former service members. The regulations on this grant are forthcoming, and we will be happy to provide details as they become available. The second grant comes out of Section 4202 of Isaacson and Rowe Veterans Healthcare and Benefits Improvement Act. And as the title notes, this is the Legal Services for Homeless Veterans and Veterans at Risk for Homelessness Grant Program. Next slide, please. This is a great overview of our Legal Services for Homeless Veterans grant. The purpose of this grant is to provide legal service grants to public or nonprofit private entities who will provide legal services to eligible veterans who are homeless or at risk for homelessness. The goal is to assist homeless or at-risk veterans who have unaddressed needs for legal services, which may create barriers to housing stability. As I mentioned, this is a great overview. We will provide this document to you for your review. Just a couple of things to keep in mind is that we plan to award up to 75 organizations with this grant program with a maximum funding of $150,000 per grant. If you have specific questions about it, please feel free to email us directly at lsv@va.gov. We also have other resources on our website, and the address is on this document. We have a link to the Notice of Funding Opportunity, in addition to the link to the online application portal. Thank you.
Great. Let's see if my audio is working this time around so that I can actually transition to Dr. Emily Edwards. Again, Dr. Emily Edwards will be presenting on the Veterans Cultural Competency Training. And if folks have any questions about what Lara or Madolyn presented on, make sure you type it into the Q&A, but we'll also be paying attention to the chat now that it is enabled. We'll plug in a couple more links to not just the directive. Oh, sounds like I can't be heard now. So Emily, I'm going to pass the mic on to you, and I will continue to share some links that Madolyn and Lara referred to in their portion of the presentation. Thanks, everyone.
Absolutely. Thank you so much, Bethany. And thank you all again for kind of carving out some time out of your Wednesday afternoon to spend some time with us today to talk about veteran cultural competence. This is something that is very, very near and dear to my heart. I am not a veteran myself. However, I come from a big military family. And so this is something that I have been constantly surrounded by just in my personal life, and then also in my professional life as a psychologist at the James J. Peters VA Medical Center in the Bronx. My kind of area of focus is in working with veterans who find themselves in legal trouble or in some other kind of crisis. And so often these veterans are struggling to navigate kind of all of the different systems to get their needs met, which is why when this team approached me about doing this training and calling it the No Wrong Door, it just so resonated with me, because that is really kind of the place that I would love for us to get to in supporting our veterans, is so that there is no wrong door for veterans seeking services. So our focus here today is to kind of increase your awareness, knowledge, and skills as they relate to veteran cultural competence. And in doing so, we hope that you're better able to engage the veterans that you're working with and help those veterans to more effectively engage with legal services. Like Lara mentioned, legal needs are commonly cited as a top stressor for veterans, particularly those who are struggling with mental health, substance use, and homelessness. So if we can better support these veterans through kind of a seamless partnership between those of us who are on the care provider side and those of us who are on kind of like the legal service provider side, and everyone in between, we're going to be able to better support these veterans, and in doing so, kind of just give them an overall better experience with the system, and like Lara mentioned, probably save a life here and there. Okay, so before we get started, I want to kind of go over our agenda for today. We're going to start with recognizing biases. Okay, so this is kind of a core to any sort of cultural competence training, if you will, is we have to recognize sort of what kinds of biases, what kinds of beliefs do we already hold about veterans and how might that be influencing our work. From there, we're going to talk a bit about just military culture and veteran culture. Spend some time talking about veteran needs, particularly the needs of veterans who find themselves interacting with legal services. And finish up with talking about strategies for veteran outreach. So what you can do to engage veterans and reach those who are in need. Okay, and we're going to keep some time at the end for some Q&A because I hope that you guys have lots of questions that we can help answer. Okay, so starting with biases. All right, so I want everyone to kind of orient yourself to the chat because I'd like this part to be a bit interactive. So I'm going to open up the chat on my side so that I can see your comments and things as well. Okay, so I want you to think about what kinds of stereotypes are out there about veterans. And for this exercise to be most effective, I want you to kind of think of things like throw them out there as fast as your fingers can hit the keyboard. First thing that come to mind, don't filter yourself. Okay, so I see them. Let's start with the good things about veterans. We've got Veterans Day coming up. What are some kind of positive stereotypes that come to mind when we think about veterans? Brave, they're patriotic, they're protectors, they're loyal, they're honorable. Love all of this. Disciplined, heroes, absolutely. Keep it going, keep it going. Brave, selfless, strong women, love the shout out. Heroic, absolutely. Okay, any other ones? Independent, oh, that's a big one, yes. Okay, so when we think about veterans, automatically, kind of all of these stereotypes, all of these associations come to mind, right? We think of the word veteran, or we think of somebody who kind of like embodies what it means to be a veteran, and we think this person is brave, this person is heroic, this person is patriotic, this person is loyal, they're honorable, they're independent, they're strong. Okay, what about the flip side? What about kind of the bad and the ugly stereotypes? Substance use, coping issues, high suicide rates, angry, they're violent, keep them going. PTSD, aggressive, had nothing better to do out of high school. Terrified of the real world, mental health issues, seeing lots of like angry, aggressive, yeah. Anything else? Keep it going. Not professional, entitled, stubborn. Okay, there's a flip side of the independent, right? Unpredictable, depressed, entitled. Okay, beautiful. All right, so I want you guys to think about this. All right, because when you have a veteran walk into your office, no matter what office that happens to be, these are the stereotypes that they kind of walk through the world with. Okay, once somebody finds out that they are a veteran, okay, and this is kind of the way that our brain organizes information is through associations. Once you learn that somebody is a veteran, all of these associations are going to come to mind. Okay, the good, bad, and the ugly. All right, so how do we adjust for this? How do we compensate for the fact that our brains are so good at relying on stereotypes and biases? Okay, the first thing that we want to do is we want to stay mindful. Okay, and just by going through that exercise, we're kind of like increasing your mindfulness just a little bit about what sorts of stereotypes and biases your brain may be reliant on. Okay, these biases and stereotypes, they influence the way that we make judgments, the interpretations that we make, the conclusions that we draw. And by being mindful of them, we can kind of limit how much those biases are impacting our interactions. Okay, so what do I mean by this? Let's say you have a person who comes into your office and you're trying to schedule a next appointment with them. If you don't know this person's military service background, maybe like, wow, this person has a lot on their plate. I'm gonna have to really work to find a time that works for both of us. If you know that this person is a veteran, you may be more likely to jump to the conclusion of, oh, this person is so rigid. This person doesn't have anything else going on. Come on. Here's the time that works for me. You need to make it work. Right? But if we can be mindful of maybe that we have the bias or we have the stereotype that veterans are rigid, it's a common one that's out there, right? Then when we see our brain kind of starting to jump to that conclusion, we can press the brakes on it. Be like, well, hang on a second. Maybe he actually does have a lot on his plate. Related to that, second piece is recognize the uniqueness. If you've met one veteran, congratulations, you have met one veteran. And while general information that might be helpful, all veterans are unique. They all have their own experiences, their own strengths, their own limitations, their own needs. Okay, so even today, we're going to talk a lot about general information. And I want you to see this as kind of like a foundation, a starting place, not the end all be all. Every veteran's going to have their own experiences. Every veteran's going to have their own needs. And so recognizing that is going to put you in a better place to be able to service the veterans that you're working with. Third thing you can do is really give space. Okay, here's a generality for you. Veterans love telling stories. Okay, that's like built into military culture. And so give the veterans some space to like tell you about their story, tell you about their experience. And while you're listening to that story, avoid making judgments or jumping to conclusions. And then the last piece, and this is really important, I cannot emphasize this enough, build experience. The most effective way for us to minimize our brain's reliance on biases and stereotypes is by having experiences with veterans, right? If when I asked you like, oh, well, what's a stereotypical veteran? You're like, I have no idea. I know so many of them. Who's the stereotype? That's perfect. That's where we want to get to, right? So seek out veterans. I guarantee you, you know more than you think you know. Okay, maybe this is in your professional life, maybe this is in your personal life, social engagement, volunteering, whatever. Okay, and so I'm going to break rule number 2 right now of recognizing uniqueness, because I want us to shift into kind of some general information, starting with basics of military culture. Okay, so when we think about culture, culture boils down to the values, beliefs, and traditions that a group of people share. Okay, cultures can be as large as, I don't know, like a racial group can have a certain culture that goes along with it, and all the way down to a neighborhood can have a particular culture. Okay, so thinking about in the context of military culture, there is culture at the level of the military. There's also culture at the level of individual units. All right, so thinking kind of in broad terms, also keeping in mind that things are going to vary depending on a person's specific experience in the service. Okay, the first thing is that generally speaking, military culture prioritizes the team. Okay, so service members, while they're in military service, they live as part of this like really tight-knit, cohesive group where the unit's goals are placed ahead of their own goals. Okay, so everything is about the team, moving the team forward, as opposed to everything is about me and moving me forward. Relatedly, there's this big emphasis on trust and loyalty. Okay, so you can imagine if the entire unit is supposed to be moving as one, the people within that unit need to be able to trust one another, to be loyal to one another. And so related to that, there's this really big emphasis on trust and loyalty. And if you break that trust and loyalty, it's seen very, very seriously and as a reflection on the entire unit. Third piece is there's this big emphasis on like uniformity and orderliness. Okay, so particularly while a service member is in uniform, they're expected to embrace what it means to be a service member. Okay, like their entire demeanor may change. Their appearance, their behavior, their attitudes, their language is all going to kind of align with the group. What does this do? This lets the unit move forward as one. Okay, again, that's kind of the biggest focus, the biggest emphasis for military culture is what needs to happen. What does this culture need to look like in order for the unit to move forward as one? So also correspondingly, there's this emphasis on duty and commitment, right? So duty and commitment to one's unit, one's country, one's mission. Everything is about the mission, okay? And commitment to that mission, even at the expense of the self, is considered highest priority. Chain of command is really salient within the context of military culture. So unlike in the civilian world, where like at 5 o'clock, I can log off most days and I can spend some time with my family, and whatever happens with my family is of no business to my supervisor at work. Within the context of military service, okay, you get off duty, you go home to your family. Something goes on at home, you better believe that your commanding officer is going to hear about it, right? So this kind of this line between work and home is far more blurred within the context of military culture, particularly within the context of that chain of command. And then the last piece is kind of this emphasis on respect and honor, right? Similar to trust and loyalty. Respect is shown through both behavior and also language. And to be disrespectful or dishonorable is seen as a serious, it's like a character flaw. And even beyond that, as a flawed kind of reflection on the unit. What did the unit do wrong that this person is acting this way? Okay, so let's say, related to kind of this idea of military culture, there are certain things that you can say in just kind of like opening conversations that are going to automatically increase your credibility with a veteran. Okay, reason I say this is because I'm going to give you kind of some opening questions to ask that are going to demonstrate to this other person, hey, I'm in the know, if you will. Okay, so the first question that you want to ask is, did you ever serve in the US military? Can pop this in the chat. Why would you ask, did you ever serve in the military, and not just say, like, are you a veteran? Seeing silence in the chat. That's okay. All right, so we want to, veterans might not recognize themselves as veterans due to discharge status. Yes, absolutely. Right, so the veteran that you're talking to might not see themselves as a veteran. Right, some people don't see themselves as a veteran if they got less than an honorable discharge. They may not see themselves as a veteran if they didn't deploy. They may not see themselves as a veteran if they never saw combat. They may not see themselves as a veteran if they just had like a crap experience while they were in the military, right? They may not identify with that label, if you will. So asking the person instead, did you ever serve in the US military, is going to get at that information more accurately, okay? And kind of take the implications of the identity piece out of it. Somebody says yes, next question out of your mouth should be what branch? Okay, so this is going to demonstrate to the person you're talking to that you realize that there is more than one branch in the military. Not everybody is Army. There are actually 6 branches in the military now. There is Army, Navy, Marines, Coast Guard, Air Force, and most recently, Space Force. Okay, so, and service members can be active duty or reservists, so it gets quite complicated in there, right? But asking them like, oh, what branch did you serve in? Demonstrates, I realize that not everybody is Army. Oh, Mary, I love your comment because we are getting there. Somebody says, oh, I was in the Army. You can ask, what was your MOS? Or what'd you do in the service? Somebody was in the Navy, they don't use MOS because Navy makes everything complicated. They use ratings, but you can ask, what'd you do in the service? Not everybody was infantry. Okay, there are people who are infantry, there are also cooks, there are also jet mechanics, there are also truck drivers. There's all kinds of things that a person can do within the context of military service. MOS stands for Military Occupational Specialty. Okay, it's essentially a shorthand for the person's job. Okay, and then the last thing, somebody had mentioned this in the chat, do not call them all soldiers. You really want to insult somebody, call a Marine a soldier. Okay, so every branch refers to service members by a unique name. They're not all soldiers. Army and National Guard, those are soldiers. Marines refer to themselves as Marine, Navy as sailors, Coast Guard as Coast Guardsmen, Air Force as airmen. And the last one, Space Force, and I just think this is amazing. They call themselves Guardians. So they're literally guardians of the galaxy. I met my first Guardian veteran like in the healthcare space the other week, and I was so stoked. Definitely made the Guardian of the Galaxy joke. I was not the first one who made it. Okay, so but I noticed in the chat somebody had asked, like, what's an MOS? Somebody else says all we need is the DD-214. Okay, remember, one of those pieces about military culture is like a shared language, right? So there is lots of jargon that comes along with military, particularly in the form of acronyms. Okay, and if you're working with veterans for long enough, you're going to start picking up on the acronyms that are most relevant to the work that you do. But some things that are probably going to come up for you. DOD, Department of Defense. MOS is a person's military occupational specialty. So like, what was their job while they were serving? OEF, OIF veterans, hear that phrase a lot. This is our most recent kind of generation of veterans. Operation Enduring Freedom, Operation Iraqi Freedom, and OND is Operation New Dawn. So these were veterans who served kind of from 2001 onward. DD-214, that's come up in the chat a couple of times. This is a person's discharge paperwork. Okay, so this kind of gives you, says that they've been discharged from military service and gives a characterization of what their military service was. For those of us who work a lot with folks in kind of the benefits space, you're going to hear phrases like service connection. This is a shorthand for kind of like disability benefits. HUD-VASH is the organization within the VA that helps homeless veterans get into housing. Voc Rehab, they've recently renamed this to VRNE. All veterans still call it Voc Rehab. Stands for vocational rehabilitation. So it provides financial support for disabled veterans, kind of beyond the GI Bill, which is the one that most people are familiar with. VBA is the Veteran Benefits Association. VSOs are like nonprofit organizations. Stands for Veteran Service Organization. All right, at the end of the day, if you don't know what something stands for, just ask. And then make a note of it so that you don't have to ask again. A lot of these things can be Googleable, right? You kind of hear an acronym coming up a lot, or you see it in an email, something to that effect. Most of the stuff, you can find the answers to it on Google. But at the end of the day, if you don't know what something means, ask. Most veterans kind of laugh it off and be like, oh, this is what I mean. Okay. All right, so taking all of these things into consideration, right, about military culture, there are some communication strategies that you can use that'll make you more effective in engaging the veterans that you're working with. Okay, so what do I mean by that? I mean, helping veterans to be comfortable with opening up to you, helping veterans to be comfortable with giving you the information that you need, and being able to build a kind of solid relationship with the veterans that you're working with. Okay, so the first piece is you want to normalize the veteran's experience. Okay, so lots of veterans, because of that kind of like military culture, emphasis on the unit, one person's failure is considered the entire unit's failure, they might interpret their personal struggles or personal difficulties as failures and asking for help as a sign of weakness. Okay, so anything that you can do to normalize their experience is going to help kind of lower their guard, help keep them engaged, keep them receptive to help. Okay, so phrases like, you know, this is not the first time I've heard this. Or, man, I've been hearing about this a lot lately. I am so sorry you're going through this. I've heard 6 veterans just this week talking about this exact issue, right? Emphasizing to the veterans, you are not the only one who experiences this, and I'm going to help you get to the other side. Okay, second thing you can do is you want to balance being an expert while also being a team player. Okay, this is what they do in the military. MOS stands for Military Occupational Specialty. Even privates have MOSs, have specialties. Okay, they are the expert in what they are doing. Everybody is an expert in kind of their lane. And it's with all of those expertises kind of combined that the unit's able to move forward. So you can capitalize on this, right? Like, you are the expert in whatever service you're providing. If you're a legal service provider, you're the expert in the law. You're the expert in legal services. You also want to balance that with being a team player. I want this to be a collaborative kind of thing that we're doing. I'll be the expert in kind of the legal services. You be the expert in your experiences. And together we'll be able to move forward, get you where you need to be. Third piece is we want to be direct. Okay, no beating around the bush. Often because of their military training, think about it, within the context of military service, there is no time for beating around the bush, right? If you are in the middle of combat, you don't want somebody to be like, well, you know, on the other side of that hill, there's something that we might not want to encounter, so we may want to, no. You want somebody to be like, hey, bunch of enemy combatants on the other side, let's go the other way. Okay, so as a general rule, again, veterans tend to respond very well to just being very direct. And if they catch you kind of beating around the bush or trying to sugarcoat something, they're more likely to see it as disrespectful. And then the last piece is be patient. Okay, this is a group that traditionally can be kind of interpersonally guarded, especially with people who they see as part of the system, and especially if they've had kind of not so hot experiences with the system in the past. Judging by the poll that was done earlier today, most of you would qualify as part of the system. Okay, so be patient and use kind of these other communication strategies to help in building that rapport. You may not get all the information that you need on the first meeting, and that's okay. Maybe you get it all by the 3rd meeting. Maybe you get it by the 4th. So be patient in kind of building up that rapport. All righty. So I want you guys to kind of put these strategies to the test, if you will, in talking about Mr. Johnson. Okay, so here's your strategies over here, your kind of cheat sheet. This is Mr. Johnson. He is a 72-year-old seeking legal support after becoming homeless. He's currently 30% service connected for major depressive disorder. Okay, so again, that means that he's getting disability benefits from the VA at a rate of about 30%. For his mental health. He's attempted to connect to HUD-VASH, again, that organization that helps veterans with housing, but he's ineligible for lots of housing options due to his history of multiple arrests in his years after deployment to Vietnam. He's generally distrustful of the legal system, though he feels like he has no options at this point. All right, so thinking about these communication strategies, we want to be recognizing our biases, normalizing Mr. Johnson's experiences, balancing being an expert, but also a team player, being direct and being patient. What might you say to Mr. Johnson? And you can pop this into the chat. what might be a helpful thing to say to Mr. Johnson to kind of engage him in a relationship with you? Wonderful. So somebody says, emphasizing that he's not the only one who struggles with housing difficulties, right? Normalizing that a lot of veterans got into legal trouble after Vietnam. Mary says, kind of relating to him in the sense of like, I remember the Vietnam War years. Okay, so we want to be really direct. I would probably follow up with what kinds of things, kind of what's his legal history that's prohibiting him from being able to secure housing. Reassuring him that like, hey, listen, I hear this a lot. Lots of veterans have kind of encountered similar issues. And I'm committed. We're going to get on the other side of this. We're going to figure out a stable place for you to live. Okay, so I'm being direct, I'm being a team player. I'm using a lot of like we language as a way to demonstrate that like we are on the same team. Sherry says, let's look at your convictions and see if we can do anything about them. Definitely. Right? Fantastic, guys. Okay, so somebody also says, ask about other sources of income and whether he's ever applied for an increase. How long ago were the arrests? Is he eligible for HUD-VASH or not? Did he actually connect with them? Who did he talk to? Right? Fantastic, right? So like we're asking more questions, we're kind of getting more information, and we're validating from Mr. Johnson, normalizing. Lots of veterans encounter this, and you know, I think it's great that you try to connect with HUD-VASH. Are there any other options that we can try? Right? Beautiful. Okay, so a couple of you had kind of drawn attention to this like Vietnam piece, right? So there are also kind of historical considerations that we can take into account when we're speaking with veterans. So each era, if you will, service era, is characterized by kind of stereotypical things that tend to come up for them. And so being familiar with sort of these stereotypical needs can help put you in a better place to be able to address those needs effectively. Okay, so for example, our World War II era veterans, if you have the opportunity to chat with a World War II era veteran, I highly recommend it. There are not many of them left. Most of them are in like their 90s. And predominantly, you're going to see like health and estate related legal concerns. Similarly, Korean War era veterans, most of them are like in their 80s or higher. Similarly, kind of these health and estate related concerns that come along with end of life. Our Vietnam era veterans, most of them are like in their 70s. Vietnam era, they served during a really high conflict period. There's lots of mixed support for military service. And so it's not unusual for, if you're talking with somebody from who served during the Vietnam era, for them to have kind of conflicted feelings about their military service. For them to not offer out of hand that they're a veteran, right? That's where that question earlier of, did you ever serve in the US military, can become helpful. One thing that is salient for Vietnam era veterans is the Agent Orange exposure can kind of come on, can kind of become relevant, particularly within the context of benefits eligibility, health-related concerns, things of that nature. Our Persian Gulf era veterans, they're now mostly in like their 50s, and they served during the most televised war of its time. So not unusual for example, Persian Gulf era veterans to question the things that they're being told, because they served during a time where what their families were saying they saw on the television did not match what their experiences were like, boots on the ground. And Gulf War syndrome is something that commonly can kind of come up for veterans from this era. And again, it has implications for like mental health kinds of concerns, physical health concerns, benefits, things of that nature. And then our youngest veterans, our OEF, OIF, O&D veterans, some of them are now in like their 40s, if you can believe it. This is the smallest military force in American history, and also the longest military conflict in American history. Okay, so you see some of these other ones, they kind of like last a decade, maybe a little bit more for Vietnam. OEF, OIF, O&D, 20 years, right? So really, really long kind of duration. So this correspondingly, like this group of veterans, very, very different depending on when in that period they served. Some of the difficulties that we're most likely to see with veterans from this era are things like readjustment difficulties. Somebody had mentioned in the chat before, it's really tough for a lot of veterans when they first are discharged, kind of coming back to the civilian world. And that's also true for our youngest veterans. A number of them struggling with PTSD, traumatic brain injuries. And this is also the group where we see the highest suicide rates. Okay, so again, just kind of being able to familiarize yourself with like, these are some of the historical differences, or even like age, generational differences that come up with different veteran cohorts can help put you in a better position to be able to provide needed services for the veterans you're working with. Lara had brought up this Project Challenge study before. They do this every year to kind of try and figure out what are some of the biggest needs that veterans face. So based on Project Challenge, these are sort of the most frequently endorsed legal needs that veterans describe having. So things related to family is really big. So things like childcare, family reconciliation, child support, things related to money, credit counseling, financial guardianship, things related to housing, both generally and also for registered sexual offenders. Housing can become, you know, like for Mr. Johnson, can become a really big barrier. Eviction and foreclosure, driver's licenses, outstanding warrants and fines, and of course, discharge upgrades are in here. A thing I want to highlight on this slide, these are all normal things. These are all normal legal kinds of needs that both veterans and civilians may experience. Okay, so on one hand, we want to be kind of increasing our veteran cultural competence, understanding the needs of the veterans that we're working with. And also, if you're not working exclusively with veterans, that's okay. You've got kind of the basic skills to be able to help with a number of these things, right? So adapt what you're doing, incorporate some veteran cultural competence in there, and you will be set to go. Okay. Also, we had mentioned before that oftentimes veterans with legal needs, that's not the only thing that they're experiencing, right? You don't just have a veteran who, you know, finds themselves in legal trouble and like, yeah, well, that's the only thing going on. If I could just get rid of this like measly warrant, life would be perfect. More likely, a veteran finds themselves in some kind of legal trouble. This could be civil, this could be criminal. We know that their risk for suicide is higher. They're about twice as likely to experience thoughts of suicide and about 1.5 times more likely to attempt suicide. Of the suicides that are completed by veterans, about 15% of them are preceded by legal trouble. Okay, so those of you who are providing legal services or helping veterans to connect to legal services, you are literally doing things that can help to save a life. Okay, second piece that comes up quite often is homelessness. Veterans with legal trouble, about 2/3 of them report some kind of housing instability. So this can be literal homelessness, meaning person is living on the street, they do not have a roof over their head. Could also be just more general housing instability. They're couch surfing. They don't know where they're going to be next week. They've got a roof over their head, but they don't know how long it's going to last. And in a recent study, 8 of the top 12 needs cited by homeless veterans required legal assistance. About half of veterans with legal trouble are reporting some kind of difficulties with finances or employment. A significant number are also describing kind of difficulties at home. So this might be exposure to violence, difficulties with child support, childcare, and then also mental health concerns. Okay, so, and we know that those who are receiving services through like a medical legal partnership, right? So where their medical providers and their legal providers are, God forbid, talking to one another and coordinating services, we see significant improvements in things like mental health, income, and housing. Okay. Also know that there's tons of VA-based resources that kind of correspond with each of these common issues, right? So for suicide, there's the Veterans Crisis Line. This is a line that is specifically dedicated to veterans, similar to like the suicide hotline. Veteran connects with it, they're automatically connected with somebody who is trained in kind of suicide crisis prevention, kind of talk them through and can hook them up with services as they're eligible from there. Veteran experiencing homelessness can be connected with HUD-VASH. A couple of years ago, HUD-VASH expanded their eligibility requirements so that now you do not need an honorable or general discharge to be eligible for VA supportive housing. Okay, this is huge. So veterans with less than honorable discharge types could still be eligible for housing support through the VA. For things like education or employment issues, I'm going to think GI Bill. We're also going to think VOC Rehab, which, like I mentioned, has been renamed Veteran Readiness and Employment, or VRNE. Most of the veterans still call it VOC Rehab. For family difficulties, vet centers are fantastic. So vet centers are community-based clinics. Okay, so they're generally separate from kind of like big VA hospitals. They're community-based clinics that offer mental health services. They also offer fantastic like couples counseling, family counseling, things of that nature. I work for a VA, and I have, if I have clients who are reporting some kind of family difficulties, I'm reporting them to a vet center, just because vet centers do such a fantastic job at it. And of course, mental health difficulties, you can always connect them with the Veterans Health Administration. Okay. So thinking about mental health, I know when we went through stereotypes and biases, PTSD came up a lot, right? That is kind of the stereotype. So let's think about kind of the needs of veterans who find themselves in legal trouble. So the most accurate estimates that we have are based on veterans with criminal justice involvement. We don't necessarily have great numbers on veterans who find themselves amidst other kinds of legal complications, particularly like civil complications. Just something that we as a field have not been fantastic at collecting data on. But what we know, those who are involved in the criminal justice system are actually seeing mood and substance use disorders as the most common. So things like depression and bipolar disorder and alcohol use disorder are far more common than a diagnosis of PTSD. And we'll get to why that might be. Similarly, despite these really, I mean, these are pretty high rates. Even the PTSD, this is like twice as high as you would see in a civilian population. Rates of engaging with treatment tend to be pretty low. Okay, so only about a quarter of them have engaged in some kind of psychotherapy, about a quarter have had some kind of psychiatric medication. Almost 1 in 5 have had a history of psychiatric hospitalization. Okay, so these are astronomical numbers in the sense that with these rates, I would expect psychotherapy and psychiatric medications to be much higher and hospitalization to be lower. Okay, so what does this mean? This means that a significant proportion of our veterans with legal trouble are also struggling with mental health concerns, and that they're not connecting to the care that they need. All right, so in the spirit of no wrong door, even if you are a legal service provider, you're not a mental health professional, that's okay. Veterans describing to you, hey, I'm feeling depressed, hey, I'm feeling anxious. It's okay to ask, have you thought about talking to somebody about it? Can I give you a card for, these folks over at the VA? Can I give you a card for a vet center? Right, helping them to connect with those services and helping them to make those connections effectively. Right, but this number, I always get some pushback on this number, this 13% PTSD. So I want to talk a little bit about trauma. Okay, this is something that does come up with our veterans a lot. It may or may not present as PTSD. Okay, so what do I mean by that? PTSD is a actually very specific and rather complicated clinical diagnosis. Okay, if the person doesn't have the exact right combination of symptoms, it's not PTSD. This doesn't mean that they haven't experienced trauma or that their traumatic experiences are not continuing to affect them. Okay, so whether or not the person has the PTSD label, we still want to consider their potential history of experiencing trauma. Okay, and what do I mean by trauma? Trauma is any kind of experience that changes a person's ability to trust. Okay, so we're going to be thinking about person's trust in themselves. When people experience traumatic events, they may view themselves as incompetent, as fragile, as broken. What's wrong with me that I wasn't able to prevent this from happening? They might be more unwilling to trust themselves, to trust their own emotions, trust their own beliefs, trust their own instincts, right? So they might question themselves more. Similarly, their trust in other people is probably going to be a bit askew. Where were other people that they let this happen, right? Thinking particularly in the context of military service, not necessarily, right? Military service, military culture is really built on this idea of the unit, right? You are a team. You watch out for the person next to you. That is your battle buddy. And yet bad things still happen. So is my battle buddy not protecting me? Was my unit not protecting me? My unit leadership not protecting me, right? Viewing others as like unreliable, unsafe, at the very least, unable to help in times of need. And so you kind of see this hyper self-reliance, this hyper independence, and a need to be in control in relationships. Because you're not trustworthy enough. I got to make sure that nothing bad happens. But at the same time, I have trouble trusting myself. And then the last piece we see with trauma is just general trust in the world. Can't predict what's going to happen next. The world's just inherently dangerous. I can make all the right decisions and the world's still going to fall in on my head. And so you might see kind of this exaggerated need to be in control of situations or be in control of your surroundings in order for the person to feel like they're safe. Okay, so taking these things into consideration, let's come back to our communication strategies. Okay, let's say that you are working with a veteran and they begin experiencing some kind of acute escalation in mental health symptoms. Okay, I'm assuming that most of you on this call have not, like me, had like 15 years of training and experience in dealing with this. And so you might yourself start feeling anxious. It's like, what the hell do I do now? Okay, so thankfully, there are also some kind of like very straightforward communication strategies that you can use in these instances. And you're going to notice they look awfully similar to our previous communication strategies. So the first one is validate. Okay, when I say validate, I don't mean agreeing with the person. I don't mean telling the person that they're right. I mean showing empathy to the person. Showing the person that you get where they're coming from. Showing the person that they're not crazy for feeling what they're feeling. right? So using validation, feeling empathy toward another person and finding ways to express that helps the client, helps the person that you're talking to realize that you're there for them, that you understand, and that you want to help. Okay, second piece is stay a team player. All right, every single person on this earth, pretty sure it's like hardwired into human DNA. As stress goes up, their desire to control a situation also goes up. Okay, if the veteran that you're working with is having an acute escalation in their mental health symptoms, meaning they're really depressed, they're really anxious, they're in some kind of mental health crisis, right? We just talked about how trauma can influence trust and influence like a desire to control situations. Okay, so their desire to control the situation is probably going to go up. Why? Because they're not feeling safe, right? They're not feeling like emotionally stable. Your desire to control the situation is probably going to go up because you too are feeling uncomfortable, right? Stay a team player, all right? Keep on the same side. I commonly use the phrase with my clients, I am stubbornly in your corner. Even when shit goes sideways, I am stubbornly in your corner, okay? Connecting to mental health care can be really difficult. And a lot of times a person can feel like they've had to tell 6 different people the same thing, and why the hell don't they just talk to each other? Stick with them through that process, okay? Third thing is stay direct, all right? Express your concerns directly. No beating around the bush just because the person is kind of feeling emotional, right? It's not going to come across as like you're protecting them. It's going to cross as invalidating and alienating. Okay. And then the last piece is fall back on your rapport. You're not always going to say the right thing. And that's okay. Like every single person on this earth has had foot and mouth disease, right? Where they just like open mouth, insert foot, and they're like, crap, that was the wrong thing to say. It's going to happen. When it happens, fall back on the rapport that you've already built to keep that veteran engaged. Okay, if you've already demonstrated that you are stubbornly in the person's corner when you say the wrong thing during a time of crisis, the person's still going to realize that you're stubbornly in their corner. All right, so let's take these communication strategies. And again, I'm going to give you a cheat sheet. Let's talk about Mr. Smith. Okay, so Mr. Smith, younger guy, 26-year-old Marine veteran, and he's seeking legal assistance after losing custody of his 4-year-old son. About 6 months ago, he experienced a psychotic episode where he believed that the government was out to get him. He was hospitalized and diagnosed with PTSD. Because of his mental instability, the courts granted full custody of his son to Mr. Smith's ex-wife. Says he's now stable, he's feeling good, and he's ready to fight for at least partial custody. Realizes that like full custody might not be the best idea, but like, let's do partial. And during your initial meeting with him, he says if things don't go well, he has plans to kill himself because life won't be worth living anymore. So thinking about these communication strategies of we want to validate, we want to stay a team player, we want to express our concerns directly and fall back on our rapport, along with all of the other strategies that we've already talked about. What might you say to Mr. Smith? Pull up our chat here. Oh, Mary, I love what you said, of like stay with the person. Don't abandon them to offload the burden. Sherry says, let's explore what most people go through when they're trying to get custody back. Have you talked to any friends with experience in this? Okay, so yeah, being pretty direct in the sense of like, this is what this might look like. This is not an easy road. Hear you, I understand where you're coming from. Love the validation. Let's make a plan, come up with a backup plan. Handled so many custody issues. I know how stressful and hurtful this time is. I love that. So like you've got the normalization in there, you've got the validation in there. Beautiful. Reassure that his life is and always will be worth living. Okay. You're still part of the team. Yep. Okay. What are people thinking? How are we reacting to this? Like, if things don't go well, I'm going to kill myself. How are we going to respond to that? Okay, so Amber's like, do you have a plan? Right? If Mr. Smith is coming into my office and he makes this kind of statement to me, right? We want to express our concerns directly. You know, Mr. Smith, I got to tell you, this is not an easy process. And I'm concerned about you. Especially, I mean, if things go sideways, like you've planned on killing yourself, are you talking to anybody? Like, is there anybody, are you connected with a therapist? Do you have a psychiatrist? Like, who's helping you out with your mental health? I'm so glad that you've kind of come this far, and this is going to be really stressful. I want to make sure that you live through this so that you can have partial custody of your son. So what supports do you have, or what supports do we need to make sure you have? Right, so we want to be as direct as we can, telling Mr. Smith, like, hey, this idea of you're going to kill yourself if it doesn't go well, yeah, no, that's not an option for me. So what services do we need to connect you with? Right. A number of people said, like, connecting with a local mental health provider, totally. Maybe referring him for some kind of psych services or an intake eval, absolutely. Right. Offer mental health care referrals for support. This is why those medical legal partnerships are so important. Right. If you're hooked in with one of these medical legal partnerships, formal or otherwise, you'll have kind of a stack of cards in your desk. So you'd be like, yep, this is the one. I want you to call this person. Actually, let's call them together. Right. Let's make sure that you get in there. After their first appointment is scheduled, next time you see him, hey, how did it go talking with Dr. So-and-so? Does this seem good? Seem like you guys are connecting? Awesome. Right. Okay, fantastic job, guys. Okay, so last piece I want to talk through before we get to some Q&A is just what you can do in terms of outreach. A lot of veterans don't realize the things that they're eligible for, or don't realize kind of the services that are out there. So outreach is really kind of the name of the game in order to get veterans connected to the services that they might need. So first thing is consider it a partnership. Okay, so like there's a reason that we call these like medical legal partnerships. Systems like the VA, other healthcare systems, they are complicated. Like even those of us who work in them, they're complicated. So building up those partnerships, helping the veterans that you're working with to navigate those systems can be really, really helpful and help to kind of keep them engaged as opposed to giving up. I think we've all had the experience of like being on hold for over an hour and be like, why am I bothering? Right now, imagine that times a million, generally kinds of systems our veterans are trying to navigate. Second piece is reach out. Right, so having even just like public education events that veterans can become aware of their eligibility for benefits and assistance can be really helpful. Build your network. The VA can be a really great kind of centralized location. Lots of veterans who don't use VA services for one reason or another. So finding other kinds of veteran service organizations that you can connect with, other ways to kind of connect with veterans can be really helpful in terms of building out your network and engaging veterans. Asking about veteran status, asking the question, right? Every single one of you should be looking over your intake forms. And if that question is not in there already, you should be adding, have you ever served in the US military? Okay, that is probably the single most effective way to identify veterans that you're already working with. And then the last piece is be an advocate. So get involved in those local organizations, those local committees, your communities dedicated to supporting veterans. Okay, so I am going to stop there because I want us to kind of have some time for Q&A. I want to thank you guys all again for just carving out some time. on your Wednesday afternoon to meet with us. I also, if there are any veterans in the audience, I really want to give a special shout out to you because it's Veterans Day on Friday. You guys deserve some special shout out. Thank you for all of the service that you gave to your country and that you continue to give to your local communities. It has been an absolute honor, and so I am going to hand it back over, and we can do some Q&A.
Let's see if my microphone works. Please, audience, as well as panelists, let me know if my audio is coming through. And if not, we do have Danielle Hodgson, my colleague here at the National Center, ready to go for us to answer questions coming in through the Q&A. First, Emily, before we get to Q&A, we want to sincerely thank you for taking time out of your schedule to share this particular training that you do conduct with other audiences, with our audience. So thank you as well for the service that you've provided to our medical legal partnership practitioner community, as well as stakeholders and supporters that have joined us here today. Sounds like, or seems like I still don't have audio, so I'm gonna move to the Q&A. And Danielle, could you read the, I think we did receive a question in the Q&A. Or at least I want to call out that a resource has been shared. So I know a resource was shared by Whitney from ONC at healthit.gov. And we might be able to scroll back to it in the chat to just let people know what that was. Danielle, I don't know if you see that in the chat, but can we call that out in the chat in case people cannot hear me? I just want to make sure people see it in the chat.
Yeah, so I think it was from Whitney Weber, and it's a resource on the use of technology to provide electronic referrals to address health and SDOH information exchange. I can reshare it if possible, but there was also a question that came up in the chat. We also had this discussion earlier when we were in tech mode. So Mary was asking if veterans get overly annoyed when we say thank you for your service, and what your thoughts on that may be.
Yes, I love this question. I did see it come up and I'm like, I'm gonna pin that one. I'm gonna go through it for Q&A. And especially this week, right? Because Veterans Day is coming up. So the phrase, thank you for your service, is one that is going to be kind of hit or miss. I'd say a closest parallel would be like if you have a close family member pass away and somebody says, oh, I'm so sorry for your loss. You're like, okay, cool, thanks. I guess that's what I'm supposed to say. But you realize that the person is just saying it because that's what people say. Right? So the phrase, thank you for your service, can often come across as disingenuous, or it can come across as, I don't actually know anything about your service. And so this is what I've been kind of taught to say to you. So if you want to express your gratitude for a veteran's service, I would say find other ways to say it. Right? Because I think a lot of us do feel a ton of gratitude for the service that service members and veterans have given to their country, have given to their local communities. Find other ways to say it. Find other ways to express that gratitude. Amanda puts in the chat, my husband always says he's not sure how to respond to it. Yeah, lots of veterans are like, thanks, you're welcome, I guess. So it can kind of be hit or miss.
Because I'm not sure if my audio works, case in point, I was pulled over for apparently speeding 5 miles over the limit in the state of Virginia. The police officer pulled my insurance and asked me for insurance, so I had USAA. That is because of my dad's service in the Army, and thanked me for my service. That made it so awkward for a response. Emily, I want to pose a question to you that actually stems from, I think, my lived experience with my dad as a veteran, and it adds another layer of cultural competency that I think our folks in the health center world, as well as MLPs across settings, hospitals and elsewhere, are really well equipped to handle. My dad is also an immigrant to this country, and so I saw in the chat that depending on your status or why you joined, there are a lot of stereotypes. And so any tips for individuals who are serving, or what may you have seen in terms of individuals that are being served by medical legal partnerships who are veterans, but also have that added layer of perhaps being an immigrant, or perhaps there is a gender identification aspect that should be.
Yeah, no, absolutely. I love this question. So we researchers, because we have to like make up words, right? One of our made up words is intersectionality, okay, which is this idea that you don't just embody one identity. You have multiple identities, and different identities may be more salient in different contexts or in different situations, different times, right? So in some contexts, my identity as a veteran might be most salient. In other contexts, my identity as an immigrant might be most salient. In other contexts, my identity as a woman might be most salient, right? So veteran cultural competency should be considered kind of like one of those potential, or veteran could be like one of those potential identities. But we also want to be considering what other identities does the person hold, and what kinds of cultural competencies do I need to take into consideration within that context as well. And I think for folks who are immigrants, that identity of being an immigrant, or that identity of their racial or ethnic identity, may be especially salient in certain contexts, especially if we're thinking about contexts that have to do with their immigration status, or contexts that have to do with thinking also, I work in New York City, right? So a lot of the veterans that I work with are like first generation, or they are immigrants. And so a lot of instances that comes up in is like when we're talking about their family, who may or may not be living in New York City. They may be back in, whatever country they moved from. So I would say consider this to be one identity, and also think about what other identities might be salient for the person that you also need to kind of be taking into consideration.
Thanks for that, Emily. Certainly think, when our healthcare providers on these MLP teams are doing those social needs screenings, right, they're picking up on those intersecting identities that may reveal additional social or legal needs that can be addressed. Thanks for addressing that. And again, apologies, everyone. My audio is horrible. There's another great question in the chat, and I just want to make sure people hear it and see it. Danielle, can you help me read that one out for Michelle?
Yeah, sure. So Michelle is asking, as a federally qualified health center, or FQHC, where can we refer veterans who need legal assistance?
I'm going to defer to my MLP folks.
It's almost a where do you start, right? And so,
yep.
Madolyn, do you want to read out what you just plugged in the chat, and I'll add to that?
Yeah, absolutely. Through the VA, we have a legal services for veterans website that does have some resources of community partners, as well as the link to the VA medical legal partnership spreadsheet. And then as the grants are awarded, we are hoping that will be June of 2023, then we will continue to update that website with the grantees that will continue to serve veterans as well under the grant program. That's a great question, though. Thank you.
I'll also say, in the spirit of like consider it a partnership and doing outreach and things like that, see if you can find organizations that are already doing this in your local communities. Most local communities are going to have either a kind of like a legal practice, or an attorney, or whomever who does like pro bono veteran work. And so find those people, seek them out, make sure that they have you on speed dial, and and then let them know about medical legal partnerships so they can get kind of hooked into the system too.
So when hopefully this audio comes through, but I just want to note that in the chat, I assume these are legal services providers who explain that lsc.gov, very similar to HRSA, so that federal agency that funds legal services, in this case, for or legal assistance for low income individuals around the country. You can find those organizations that receive LSC grants if you go to lsc.gov. I hope my audio is coming through, but it is in the chat. Also, to what Emily mentioned, the place to start, a good place to start for finding those core of volunteers might be the state bar associations. They help to organize this, but also I'll put in a link to another national level organization that really helps to organize these volunteers and pro bono attorneys who provide services specifically to veterans, and they help to organize those core of veterans serving legal services providers around the country. And they coordinate with LSC. They coordinate with all of the rest of us at the national level. All right. Want to just note that we are running out of time, but if anyone has a final question, please feel free to plug it into the Q&A in the chat. In the meantime, I'm going to scroll to the next slide and give everyone a heads up about another awesome presentation that I'm just going to challenge the panelists on the upcoming presentation to match this one, because we're very lucky to have Lara, Madolyn, and Emily present today. And then also, because of the support from HRSA, there's free training on veterans cultural competency. But coming up in December, we'll also have another HRSA supported training event, and actually be joined by a colleague at HRSA, Sonia Hunt-Gray, the Whitman Walker Health Team, as well as the Legal Clinic for Disabled MLP teams. We'll be talking about the history as well as where we can continue to go on using the MLP approach to address the legal needs of racial and ethnic minorities, in particular, living with HIV. Please sign up for our newsletter if you haven't already, so that you can join us on that event. Also, if you sign up for our newsletter, that's where you'll definitely receive a link to the slides and the recording from today's event. Let's go to the next slide. I want to make sure I put in a special plug. Let's go one more slide forward to just highlight what will be. There we go. Perfect. So when folks receive the slide deck, just note that we have shared some additional resources that, thanks to the Bob Woodruff Foundation and continued work, or past work and continued work that we do with our colleagues at the Veterans Administration Office of General Counsel, these issue briefs will be shared in the slide deck. And then our friends and partners at the National Association of Community Health Centers have also they weren't able to join us today, but they did kindly share some additional resources that you can find at their website. And I would also encourage folks, especially from the health centers, to join that Veterans Interest Group mailing list, as well as the meetings. To the audience, I want to thank you all again for joining us. I know we talked about, thanking people for their services, but I want to note that many of you are, in fact, providing those very critically needed services to individuals in healthcare spaces, social services spaces, as well as legal services. So thank you for taking time away from your day-to-day to learn more about how you can better serve veterans who are coming through various doors in your community, and perhaps they're also your family members. And now I know when I call or text my dad this Friday, what I'll be able to say to really acknowledge his contributions through military service and then through his day-to-day lives. Thank you all for joining us today. Dr. Emily Edwards, Madolyn Gingell, and then I think Lara Eilhardt had to hop off the webinar, but I want to thank her as well. Folks, don't forget, this is funded by HRSA, and they do require us to fill out a survey or share survey results. So help us improve our events and resources by taking a moment to fill out that SurveyMonkey link. Thank you again, everyone, for joining us, and we're out. To stay safe and take care, everyone.